Leukocyte adhesion deficiency type 1, or LAD1, is an inherited immunodeficiency disorder caused by defective CD18 integrin. Leukocyte adhesion deficiency does exactly what its name suggests. It impairs the ability of white blood cells, or leukocytes, to stick or adhere to the walls of blood vessels. This makes them unable to migrate where they need to go. There's a lot of facts about LAD that you need to remember, so I'll share my visual mnemonic to help you remember all about LAD for test day. Let's set the scene. We are looking inside a voting center. First, take a look at the old man over here wearing the "I voted" sticker. If you've ever voted, you may have received this white sticker as well. You know, the white round sticker with the flag on it? Anyway, this white sticker actually reminds me of leukocyte adhesion. You know, since this sticker is white and round, symbolizing a white blood cell, or leukocyte. And since adhesion is about sticking, this white round sticker represents leukocyte adhesion. But they must have gotten the cheap stickers this year, because this sticker is already peeling off, just like all the other stickers that have already fallen on the ground. You might even say that these stickers are failing to adhere. Coincidentally, white stickers failing to adhere reminds me of leukocyte adhesion deficiency. You see, LAD stands for leukocyte adhesion deficiency, and it is a disorder in which white blood cells fail to stick to the walls of blood vessels. There's actually several types of LAD out there, but the only one you really need to know for your exam is LAD type 1. Let's dive into the rest of this scene to learn more. If you've ever gone voting, you might recognize there's an age cutoff required to vote. Yep, notice that sign with the Vote 18 Plus written on it? It's just reminding us that you need to be 18 in order to vote. Coincidentally, the number 18 also reminds me of CD18. LAD type 1 results from defects in CD18, which is a crucial part of an integrin protein used by leukocytes to stick to blood vessel walls. So when CD18 is defective, white blood cells can't stick and we get an adhesion deficiency. So we know that CD18 forms part of an integrin, but which integrins are we talking about? To find out, check out this snack cart in the back. This guy must have thought he could make some extra bucks by selling mac and cheese as a snack to the lined up voters. But wait, this is no ordinary mac. Nope, this guy knows his older voter demographic, and he's catering to their health-conscious ways by offering low-fat mac. By the way, low-fat actually reminds me of LFA1. You know, low-fat for LFA. And mac? Well, that represents MAC1. Mac for MAC1, get it? Putting this together, the low-fat mac cart represents both LFA1 and MAC1. LFA1 and MAC1 are similar integrins that both have a CD18 subunit, and thus depend on CD18 to function. Basically, deficiency in CD18 expression leads to downstream dysfunction of LFA1 and MAC1. Since LFA1 and MAC1 help leukocytes stick or adhere to blood vessels, leukocytes cannot leave the bloodstream to go to sites of infection without these proteins. So these "I voted" stickers are supposed to travel with you on voting day, right? However, since they're falling on the ground instead of stuck on a shirt, these stickers aren't traveling anywhere. This should remind you that LAD type 1 leads to impaired white blood cell migration. To understand why defective adhesion impairs migration, recall that white blood cells use adhesion as one of the key steps to migrate out from the blood into peripheral tissues. You know, since these leukocytes start out circulating in the blood, to leave, they need to first stick to the vessel wall before squeezing out between gaps to get to peripheral tissues. Impaired leukocyte adhesion therefore impairs leukocyte migration, and blocking white blood cells from exiting the bloodstream obviously prevents them from doing their job, fighting infection. In fact, this impaired migration is so pronounced during infection that you'll see insanely high levels of circulating white blood cells in these patients. When the body sees an uncontrolled infection, it responds by making more white blood cells. However, none of these white blood cells actually reach the site of infection, so they just keep accumulating in the bloodstream. And the cycle goes on and on. Impaired migration of leukocytes explains why these patients get the symptoms they do. Let's talk about these clinical consequences. See how this older voter is holding a cane? Voters tend to be an older demographic, so this cane fits right into this scene. This cane also happens to be our symbol for immunodeficiency. Since immunodeficiency means a weakened immune system, and a cane is used when someone is too weak to walk, right? This cane helps us remember that LAD type 1 is an immunodeficiency. But you probably already knew this, since we just talked about how white blood cells are trapped inside the bloodstream. Since they can't adhere, they can't migrate out of the blood to fight infections in peripheral tissues. Let's see what happens as a result of this immunodeficiency. Take a look at the leash burn on the old guy's arm. Yeah, he has a dog, but the dog pulled away to go cuddle with the snack guy, leaving this nasty leash burn. This fresh wound coincidentally reminds me of delayed wound healing, a classic symptom of LAD type 1 patients. A wound for poor wound healing. Got that? Importantly, this wound is clean. Yep, it just happened, so there's no pus or anything in it. This helps me remember that not only is wound healing impaired, there is no pus at injury sites. Again, there is an absence of pus at wound sites. It should make sense that LAD causes delayed wound healing because leukocytes are an important part of the wound healing process. White blood cells play important roles in killing pathogens, clearing away dead tissue, and forming scar tissue. Since the leukocytes can't migrate effectively in LAD, it follows that we get delayed wound healing. Importantly, recall how neutrophils are responsible for the creation of pus through the release of myeloperoxidase. Since neutrophils are white blood cells, they can't leave the bloodstream in LAD, meaning that there is an absence of neutrophils, and therefore absent pus in wounds. I'm going to repeat this because this is high yield. Wounds and infections will have a noticeable lack of pus in LAD. Okay, now, let's get back to the offending dog on the other end of the leash. Notice how the owner is trying to get his dog back from the snack guy, but he can't pull the dog away. But why is that? Because the dog is just loving his belly rub. This inability to separate the dog from his belly rub helps me remember delayed separation of umbilical cord, a hallmark symptom of LAD type 1 in infants. Once again, this happens because leukocytes can't migrate to the umbilical cord to clear away the dead tissue, thereby prolonging the process of separation. Since this finding is pretty out there, test writers just love putting it in vignettes about a baby to test your understanding of LAD. Alright, now that we're talking about babies, maybe we should talk about who gets LAD in the first place. Actually, LAD type 1 is quite rare. Let's focus back on the snack cart. Carts are a type of auto, so this small, recessive snack cart is our symbol for autosomal recessive inheritance. And all snack carts are these tiny, dinky-looking things, so this is definitely recessive. LAD type 1 is inherited in an autosomal recessive pattern. In other words, LAD is pretty rare. Autosomal recessive inheritance is the lowest yield of the inheritance patterns, but I thought I'd just include it for completeness. Alright, that's it for LAD type 1. Let's recap quickly and get out of here. Leukocyte adhesion deficiency type 1, or LAD type 1, is an autosomal recessive immunodeficiency disorder. LAD type 1 occurs due to defects in CD18, a critical integrin protein that makes up the LFA1 and MAC1 integrins. Defects in these integrins then impair the ability of leukocytes to stick or adhere to the walls of blood vessels. Ultimately, this failure of adhesion leads to failure of migration, leading to white blood cells getting trapped in the bloodstream. Clinically, this presents as an immunodeficiency with recurrent infections, delayed wound healing without pus formation, and delayed separation of the umbilical cord in infants. Phew, now we're actually done with LAD type 1. I'll catch you on the other side.